The information presented in this podcast is for educational purposes only and is not meant to be a substitute for clinical mental health treatment. If you or someone you know is experiencing a mental health crisis, please dial 988 or head to your nearest emergency room.
Welcome to the Black People Die by Suicide 2 podcast, where we discuss all things mental health with an emphasis on suicide in the Black community. I'm your co-host, Jordan.
And I am your co-host, T-Kea.
If this is your first time tuning in, welcome. If you are returning for more, welcome back. Before we get started on today's episode, as usual, we're going to do a check-in and acknowledge how we're feeling and doing today. T-Kea, how you doing?
Girl, first we got to acknowledge, just in case y'all missed the last episode, okay? We shared updates that we are going to have a virtual episode and then an in-studio episode. And that will be the format until further notice. Jordan talked about how, we're not just a nonprofit. We're not just a podcast. We are a full-blown nonprofit organization. It takes money to run an organization. And so we just have to make sure that we spread out our very limited resources. So it costs to rent the studio. It costs to use the engineer. It costs to have everything edited and all pretty. So we just had to move some resources around. You're still going to get your podcast. If you're listening, there's not a difference, for you. But if you're watching on YouTube, you'll get the one in the studio, and then the other episode will be virtually. So just rock with us. The content will still be great, but these are our humble beginnings, and we're doing what we can so we can make sure that we continue this mission, and with one of the ways that we're doing that is the podcast. So anyway, back to Jordan's original question, the check-in. So as far as the check-in, I'm feeling a mixture of emotions, and I think we'll kind of get into that a little bit later, but I'm happy or proud of us. Today we spoke at the Peer Leadership Conference that was hosted by the State of Maryland Office of Consumer Affairs. And there were like 200 or like almost 200 peers from the state of Maryland that was on that conference. I just felt so proud when we were done. Like, I just knew we did a good job. I was like, we ate that up, as the kids would say. So it was great. The presentation was great. We got so many just amazing feedback. Everyone said that it was interactive. The presentation went well. And it was just a really great experience. So I was very proud because that was something a little bit different that we tend to kind of do. Like, we had suicide, but I think speaking to what it means to be a peer and a leader in personal development, professional development, and, creating goals and kind of what that looks like from having something become an idea to execution. And I felt like we were the perfect people to talk about that. So I am proud about that. And then, I think my emotions have kind of been a little all over the place today, because, we did lose yesterday, Hydeia Broadbent. So we'll talk about that a little bit and how that has been impacting me a bit. So that's how I'm doing. I guess it's just more so a mixture of emotions.
Yeah, you know what? I am so glad that we got to do the peer conference today. Like T-Kea said, everyone really, really enjoyed the content that we presented. Everyone participated with our questions. It was interactive. It was wonderful. And this was a little bit of a change from what we normally talk about, but we're very happy that we were so well received. So if you were tuning into that peer space today, we thank you. As far as how I'm feeling, y'all, my body is my body is done with me. I
You
am
effing tired?
girl. I am experiencing some overactivity. I have autoimmune conditions. In case I haven't mentioned that before, I think it's probably been a while since I mentioned that. But I have lupus. It's very, very mild lupus that does not bother me. So I really don't have any issues with it. My issue is rheumatoid arthritis. And my condition is very, very active right now. So my body is just so fatigued from the pain. My joints are a little stiff. Yeah, definitely feeling pretty fatigued, but emotionally I'm feeling okay. You know, this is like people die by suicide too. We are transparent with one another. I definitely feel myself experiencing a bit of uh I'm going to say a bit of a depressive mood just because I feel so tired and because the pain's been a little bit more. But I'm hoping that normally it's a little bit better for me when the weather is warmer. So I'm looking forward to the spring because this cold weather is rough on joints. If you have autoimmune problems, you probably can identify with that. But I'm feeling tired, but and a little slightly getting a little depressed, but we're gonna manage and stay on top of it. I have my counseling appointment tomorrow, so I'm gonna talk with my therapist about it. And I'm gonna try to be proactive and stay on top of it so it doesn't get worse. But for now it feels manageable, so I'm grateful for that.
Well, for starters, friend, you told the podcast before you even told me, so we'll talk
Wait,
about that
really?
offline. Yes. You didn't tell me like I know about your autoimmune challenges. I'm not talking about that. I'm talking about the emotional component. I had no
Oh,
idea.
yes, yes.
So she told y'all before she told, or we're finding out at the same time.
Yes.
I'll deal with her offline, okay? So
You know what? These are actually pretty new developments. Like, if you're tuning in, T-Kea and I, we did go out for our birthday and for my birthday and her renewed resilience day, her second birthday. And I was feeling fine. So this is some new developments. Normally I hadn't been feeling this bad, but over the past week and even a little bit this weekend, it's just been a lot of fatigue. So I'm staying in bed more, which doesn't usually bode well for my mental health anyway. So today I felt a little bit better because I was up and we did the peer conference. So I was engaged with that. So I felt a little bit better today. But if you have chronic health problems, especially chronic pain issues, it can be a lot on your mental health and it does wear down on you. So everyone who's experiencing that, just know that I am with you in solidarity. Um, but I'm hopeful that things will get a little bit better once it gets a little warmer.
yeah, well, I'm glad that I know now so I can do a bit of a more well, we talk every day, but I guess you'll tell me even if I don't ask, but I'm still a little like, my antenna's going up a little bit. So, yeah, but if I don't know, we may have some new listeners, but every episode in the beginning, we always check in. Like, we're not allowed to say I'm fine. If you were OG listener from 8 months ago, then fine means feelings I'm not expressing. So that is not emotion, not an emotion. We don't use fine. We don't use okay. Good, probably, because that's not an emotion either. So it's to encourage conversation around getting in touch with our feelings and how we're feeling and what's going on and actually being able to identify our emotions. So I would encourage you to check out the feelings wheel, but now also just not how it's impacting us. Because Jordan, you just talked about like how your physical health impacts your mental health and vice
Mhm.
versa. So like it's important to be aware of those things so that we can know we can get the support that we need so we can do what we need to do for our own self-care because they both interact. It's not our mental and physical health, they're not separate at all. We treat it that way, but it's really not. So we just want to encourage y'all to get in touch with your feelings, with your thoughts, know what's going on, and then do what you need to do to practice self-care, and also to reach out and get the support if you need it or if you want it, I guess, because some people may not want support but need the support. So, but yeah, so I'm if you are new here, that's kind of why we had this check-in. And this check-in is probably a little bit longer than we normally do, but that's okay because we need to talk about these things. So, Jordan, should I bring us into the topic, or do you want to bring us into the topic?
So, for today's episode, we will discuss the importance of advocating yourself while involved in mental health treatment. So, it's often the case that there's a bit of a power imbalance when it comes to treatment because our doctors, our psychiatrists, psychologists, therapists, our licensed mental health professionals are sort of seen as the expert, if you will. So, it makes us a little bit hesitant to express whether we feel that things are working well, if something should shift with the type of therapy or modality that we're engaging in, our medication concerns, et cetera, et cetera. So we want to talk about the importance of being able to advocate for yourself. Because, yes, while that person on your treatment team is the professional in terms of having that licensure, we're ultimately the experts of our own life, right? So we're trying to foster a relationship with our mental health professionals that is collaborative. We want to encourage people to speak up if you feel like something isn't quite going as well as you hoped it would, because it may just be a slight shift in your treatment modality that will help you out. And we'll get into a little bit more with what all that entails. So, one of those settings that you may be a little bit hesitant to talk about or advocate for yourself is in therapy. So I think Takia and I have both experienced this with our therapists at some point, and that's letting your therapist know that you may be in need of a higher level of care. So, of course, as a therapist, receiving therapy, it depends on how often you're receiving treatment. You may be going once a week, every other week, once a month. Some places even do appointments that are extended out even further than that. And sometimes that's just not enough. Sometimes your mood kind of just goes down or deteriorates to the point where you need a higher level of care. And usually that will entail some sort of hospitalization program or even an intensive outpatient program. Takia, let me know your thoughts, feelings on that, because I think we've both been through the same thing.
Yeah, I mean, when you talk about no, I think this comes to having a level of self-awareness.
Hmm.
Sometimes when you were talking, it made me think about sometimes people will go to a therapy session. Maybe they're new to therapy, or maybe they've been in therapy for a little while, then it's this not working. This not working, but without taking time to reflect to say, like, is advocating for yourself, is this the right therapist for you? Just because they're a therapist, that don't mean they're a good fit for you. So stopping in and checking with that, and then saying their treatment modality, whether it's cognitive behavioral therapy or DBT, dialectical behavioral therapy. I think I said that right, didn't I? For
Yeah.
DBT.
Yeah.
Yeah. I'm like, okay, I don't need y'all therapists eating me up. So for DBT or solutions-based therapy, like all of those, like they have different treatment modalities, and maybe that one is not the best for you. And then also asking, like, what are my expectations from therapy? Because sometimes, especially if you're new to therapy, you may not even know what to expect. Like some people think therapy is just going in and talking about your problems. Like, I mean, that's like a quarter, a fourth, I don't know, of it.
Right.
Like it still requires work. And I know Jordan's probably laughing because she knows from experience. But so it's like thinking about all of that. And so since I have been in therapy for a little while with Dr. T, it's like I have I have the tendency, at least I would say like within the past like maybe 2 years, when stuff starts getting like too hard for me, I have the unhelpful coping skill of avoidance. And while I have gotten better, it creeps back up like, hey girl, we about to avoid today, So so I have to be aware of that. And I was just talking to my therapist and she's like, T-Kea, when you start getting to the point where you feel yourself starting to pull away from therapy, she's like, I want to encourage you to like push through those hard moments. Because the pattern is often I avoid and I fall into a deeper depression. Falling into a deeper depression, then I'm more likely to be suicidal, So it's just like a ripple effect. And I remember at this most recently, like my therapist was out of she was out. I think she was sick or something and she had needed time to pull away. And when I was seeing her once a week, I was just thinking to myself, like, this is not gonna cut it for your girl. And instead of talking to my therapist to say, like, hey, I want to go to, I think I need a higher level of care. The past few times I would just tell her, and my therapist was like, I would like us to have a conversation about it before you go and make the decision. Sorry, Dr. T. So, I'm like, okay, we can have the conversation just because like I know what a lot of resources are, but but that kind of speaks to building trust, And so I was like, what do you mean I don't trust you? Like, yeah, I trust you, but it's just more so like having that conversation. So I, talked to her and I'm just like, hey, I think I need to do like an intensive outpatient program. I don't know where you're listening from, but if you're in Maryland, there is a distinction between IOP and PHP. An intensive outpatient program, like I'm in one right now, and I go 3 days a week for 3 hours. So 9 to 12, Monday, Tuesday, Thursday. That is 9 hours of therapy. Okay. And I just started again seeing my therapist because I had took like 2 months off because I was avoiding her. But this IOP program is like 6 to 8 weeks. I think I'm in like week 6. And now like I said, I mentioned I'm back in therapy again. And so that's a lot. That's 10 hours a week that I'm in therapy. Y'all talking about tired? I'm tired. But I say that to say when we're talking about like advocating for yourself, being able to say like, this is what I think I need, but I think sometimes people don't even know what they need because they don't know what resources are available.
Mm-hmm.
And so like, this is my first time trying the IOP program, intensive outpatient, but in Maryland, we also have PHP, which is partial hospitalization program, or either a day hospital program. They go by both names, which is where Jordan and I met.
Right.
And so that one is more intense because you go for like 7 hours a day and like 5 days a week. Like you would go to a job, like you get there at like 8 o'clock and you leave at like 3 or 4 o'clock. So it is an all day thing, but you go home at night and you come back and then you have the weekends off, and you usually do that, maybe from 2 to 4 weeks. It just depends on your progress. So I say all of that to say, anytime that I notice that therapy on its own is not working and I need a higher level of care, then those are often my ways of advocating for myself and telling my therapist, like, hey, I need more. Or sometimes there have been instances where I didn't do PHP or IOP. I would just ask my therapist, can we see each other twice a week?
Mm-hmm.
So being able to speak up, while yes, the clinician or the provider, they are the experts in terms of like they know the field, but ultimately I will say there are instances where we don't know what we need, but there are many instances where we do. And so now I've gotten more comfortable to say like what it is that I need, like inside the therapeutic space, but then also realizing even from like a medication standpoint as well. Because when I was in the PHP program, I think this was last year, and the psychiatrist was trying to increase my dosage. And I was like, no, like I want to be on the least amount of medication as possible. I I do not want to be on a whole bunch of medication. That's just my personal preference. Everybody is different. And so they're like, wow, you're on a really low dosage. We'll see how you do there, and then we may need to increase it. And I said, okay. But I also realized for me, being on that low dosage work because not just because it was the medication, but also because I had to vouch for myself and advocate and say, I want y'all to know, I'm telling this psychiatrist, I am not solely relying on my medication to maintain my mental health. That is one small portion. Like, also taking care of my mental health is making sure that I'm getting, 7 to 8 hours of sleep. Also taking care of, for me, is going to the gym and working out, making sure that I'm not isolating too much and I'm spending time with people, making sure that I'm reading, making sure that I'm journaling or doing deep breathing or whatever, any of those things that help me. Like, it's a combination of things, making sure I'm spending time with people that I love, making sure I have time alone to myself, like all of those things. And I had to tell them, and they just was like, oh yeah, she's very self-aware and she knows. But most people, I feel like, they just take it because it's just like, oh, that's what the doctor said. That's what the therapist said. But it's like when you think about your mental health, I would encourage people to think about it as a holistic approach and don't think it's just therapy or it's just medication. When you're talking about advocating for yourself, even within having a support system, like advocating and letting people in your support system know, like, this is how I feel best supported. Can you do X for me? Can you do Y for me? And so I think when we're talking about like advocating for ourselves as it relates to our mental health, it's like within our support system, but also within the mental health system.
Yes, you made fantastic points. I was giggling to myself at several different points of your speech, and one of them was T-Kea knows I am famous. I am that irritating friend that asks like, have you talked to Dr. T? And she's like, girl, gone. I don't even want to talk about this right now. But I am usually asking her if she's talked to her therapist. And she's like, no, I don't want to talk to her. And I'm like, okay, you know what I'm saying? I have to respect it and give her space. Maybe she just, doesn't want to talk to her therapist. Um, Two, I was giggling because I want to encourage people not to fall into the trap that I always fell into with therapy, which was the thought that therapy wasn't working, but I was not actually implementing the tools that my therapist gave me. So for a very, very long time, I think I talked about this episodes ago, probably way back in the beginning. I was that client who would go to therapy and just vent and just talk and rage it out. And my therapist would give me homework. I wasn't doing that. I didn't need to do that. All I needed to do was show up and talk. And for years, I thought if I just talked enough, all of my problems would be gone. And I would never actually take like the homework piece seriously. But that's actually when a lot of the real work begins. They give you lots of helpful tools, lots of things that you can practice and implement. I got a lot of journal exercises. I did a lot of workbooks about trauma. And I was always trying to avoid doing those worksheets. But again, don't fall into the trap like me because it's work outside of therapy. You know what I mean? Like,
You just thought you
mm,
was just going to talk your problems all the way out without doing the homework.
yes, I was convinced. I'm like, I don't need to do a worksheet. That used to irritate me so bad early in the very, very beginning of my treatment journey. But now I can appreciate the fact that, my therapist was trying to get me to actually work through things. And it's not like you would just work through it and then not come back to it. I would meet with my therapist the following week, and she would have the expectation that I did the worksheet and we were going to talk about it. So even though I was supposed to do the work independently, we were still going to bring it up and process it. But it just, for whatever reason, I just knew I could vent my problems away, and it just did not work like that. So don't fall into that trap like me.
Jordan, what did your therapist say to you? Tell them what your therapist said to you.
Wait, what'd she say?
She asked you why you keep coming back.
Oh, okay, y'all. Yes, I had a therapist drag me. And you know what? I respect it because she was 100% right. She looked at me one day. I hadn't done my homework. This was going on for like months. And she looked at me and she was like, "Why do you come to therapy?" And I was like, "What do you mean, why do I come to therapy?" Like, I come to therapy to talk to you and to vent to you about my problems. And she was like, "No, Jordan, you're wasting your time if you're not going to actually implement the things that I'm giving you to implement." And I was like, "Oh, she probably has a point there." Like, I just knew if I cried and yelled and screamed long enough, I was going to find deliverance, but it wasn't working out like that. And yes, I had a therapist drag me about that many, many years ago. I'm so glad you remembered that, because
No, but it's so true. I think it's a conversation that needs to be discussed, because it's a conversation that needs to be had, discussed, whatever. I don't even know how they came up, but needless to say, we need to talk about it,
yes.
because I think there are so many misconceptions about what therapy is.
Mm-hmm.
And it's one thing to go to therapy and talk about your problems, is another thing to actually sit there and process it. And then also realizing that there are some things that you are going to learn about yourself that you may not like.
Mm-hmm.
And that is a very hard pill to swallow. I have learned some things about myself, like, ooh, I didn't even know I was doing it, but we all have blind spots. And that's another benefit of therapy. It's like through talking about it, you begin to have a level of awareness, and those blind spots are no longer, you can see them now. And so then actually doing what it is, like you said, talking about doing the homework and pushing past those things that are hard to do, because if not, we ultimately will just stay the same. Like
Yes.
there would be no growth. And that's the thing, like therapy requires actually doing the work.
Yes.
And I cannot reiterate more that therapy is not just talking, because if that was the case, many of us who talked about our problems all the time, like me, I've always been vocal about my challenges outside of maybe like my mental health stuff. But in terms of like saying like, oh, I watched my mom be abused and my dad was on drugs and I saw drug dealers on the corner and I grew up in public income housing. Like I would talk about like all of those things. But even though I was talking about them, I still wasn't healed from them.
Mm-hmm.
And people just automatically assume because you talk about something that means you're over it, or that means you healed from it. And that's the furthest, I think, from the truth sometimes. Like now, yeah, I can talk about it, but now I'm able to make the connection to how certain things are tied to my depression, how certain things are was tied to me before, like feeling silence, or how certain things was tied to me when I used to be really passive aggressive. Like all of those things. And so now it's able to make those connections, because when you're able to make those connections, then you can change those behaviors. And I think that's ultimately how we become better people. That's probably a slight tangent from advocating for yourself. But in order to advocate for yourself, you do need to be self-aware. So I guess I spent around the block and pulled it together.
No, you did great. If you hear growling in the background and barking, that's our mascot, Lucy. That's my pet.
Lucy, that's my niece. Hey, Lucy Luce.
She hears my neighbors generator going off, so she thinks it's something outside. She's so silly, so I apologize for that. Another thing that kind of came up for me throughout the years, I've had periods of being more depressed and periods of feeling like I was a lot better in my recovery. So I would have moments when I would talk to my therapist about, hey, seems like you're doing pretty well. Do you want to drop your appointments down to twice a week? I've even been at 1 month, which at that particular counseling center, you actually had to be on a 1 month. I think that was their minimum just for insurance purposes. So I've done 1 month appointments before. Right now I'm on weekly, which is the appropriate. It's exactly what I need. So even having a conversation about, you know, increasing your counseling sessions, decreasing your counseling sessions might be something to look into. So for medication, I was definitely a tough patient because I was that person who wouldn't take my medication as prescribed. I wouldn't show up to my appointments on time like I was supposed to. I'm showing up months late, running out of medication, etc. when I was taking it. But at the time, most of the medications that I needed was for my depression and my anxiety. Though I have been on different things for PTSD as needed. And for my anxiety in particular, that's probably the thing that most heavily affects me on a day-to-day basis with, maintaining employment, um, actually getting things done. I have an anxiety that feels like crippling. It really does keep me from doing the things that I need to do. And I needed to be medicated for it. This was years ago. And my psychiatric nurse practitioner wanted to put me on a particular medication that was habit forming. And I had to tell them, I'm not taking that. Because the last thing I needed, I already had issues with, I guess, compulsion. So I would compulsively eat, I would compulsively shop. The last thing I needed was to form a habit or, um, not necessarily a habit, but end up having my body be dependent on a particular medication. So I was like, no, can you prescribe me something else? And she tried for a good while to get me to take that medication, but I just refused to do it. So sometimes you have to advocate for yourself in terms of medication. If you are taking a medication, if you're having side effects, don't be afraid to talk to your physician about them. They may be able to make some adjustments, maybe not. They might want you to stick through it and see if the side effects taper off. But all of that is a discussion for you to have with whoever is prescribing your medication. Definitely don't do like me and start making adjustments or quit cold turkey on your own. Definitely have that conversation with your prescriber, but I just thought I would include that because they tried to give me a medication that I wasn't comfortable taking, and I had to push through like, she's the expert, she knows what's best for me, and say, I don't think this is gonna be what's best for me, so that's my medication story.
I'm so glad you brought that up, Georgeezy, because it made me think about, like, even now, I'm currently, I just kind of ebbs and flows. That's the very draining part of bipolar disorder. But it's like, even when even though I tend to be more on the depressive side than anything.
Mhm,
And I remember now I have a nurse practitioner, and and she was like, she's like, "You sure you're on a very small?" She's like, "You're on a such a small. I think the lowest dosage you can be on is 25, but I'm on
mhm,
50." And I was
mhm.
like, "No, like that's okay. If I could be on 25, I would, but I'm still like, I feel like this is a good uh I guess dosage for me right now." And my goal is I would like to. I haven't done it yet just because I haven't really had I'm gonna put in air quotes, like stable moment, if you will, like, because, I've been grieving a lot, I've been losing a lot of people. So it hasn't been really a good time, but I would like to get to the point where I will advocate for myself, and I would like to go a period without medication to see how I try, to see how I do with just straight my coping skills. I may do really well and be like, oh, I don't need it anymore. Or I may be like, yeah, no, I need it.
Right.
And I'm open to either or, but I would like to try it. When it comes to that, there are many physicians, they're going to give you pushback and they'd be like, no, you need your medication. I wouldn't do that. I was you. I remember I'm not going to say the doctor's name, call her Dr. A. Okay. And she was so adamant about like, not like, no, like, I'm not going to take you. I'm like, just not going to do that. I didn't even have a conversation with this doc. No, I had a conversation with her, but after I kept having multiple conversations with her, and she's just like, no, you need to take the medication because you know how bipolar disorder, just going on. And it was like, I hear you, but I just want to lower the dose. And then I'm not going to go cold turkey. I would like to work with me to be tapered off and see how I respond. She just was not working with me. And so I didn't even have a conversation with her to say like, this relationship is not working out. She was one of those, like, she was a Black doctor, but she was very one of those like old school, like headstrong kind of doctors. And it's fine, but I just feel like she was just like a straight shooter. And I don't mind people being straight shooters, but I think as it relates to mental health, I feel like there's a fine line. People are coming to you at their most vulnerable times in life. And while I feel like tough love has its place, I just feel like we have to be very mindful of when to use tough love when people are struggling with their mental health. And that was just kind of like and I just never really particularly cared for her. And so I just was like, I'm not going. I'm just going to stop going. At that point, I wind up going into a PHP program, and I told them, I do not want to see Dr. A. Like, I don't want to go to her. I need to make sure, I want y'all to find me someone else. And then that's when I have the nurse practitioner that I had now, and I've had her for like a year. But that was me advocating for myself. Now, it probably would have been helpful. Shout out to Dr. Walker. If I had I guess like a closing section appointment with her and like ended things. But at that point, I was so fed up. I was just like, I'm not going back. So but I advocate for myself when I was at the hospital and just saying, like, find me somebody new because I'm I'm not going back to her. So these are moments where we just want to encourage you to like, yes, they are experts, but we're also expert on our lives. And granted, there are things that we may not know and we need their help, but sometimes we know there are moments where we don't know what we need, but then there are moments that we do know what we need and we still won't advocate for ourselves. And so we just want to encourage you to, to do that. The mental health system, and especially in America, I don't know how it is in other countries, it can be very daunting, very draining, very discouraging. And it is so important for us to advocate for ourselves, even though it's hard. And even if you're someone who struggles with doing that, I would encourage you to work with your therapist to say, like, I have a hard time advocating for myself. I have a hard time speaking up for myself. Like, those are skills that you can also develop in therapy as well.
Yes, and for anyone who may be struggling with, I guess, the medication piece, or maybe you live in a smaller town and it's a little bit harder to connect with a psychiatrist, I think you should definitely expand your search out to a psychiatric nurse practitioner or a PNP. Um, they tend to have a bit more bedside manner. No shade whatsoever to the wonderful psychiatrists who are out there doing their thing. But that's another avenue that you can look into if you are having a difficult time finding a uh, psychiatrist. It's been several years since I've actually gone to one outside of a hospital program. I've been using a psychiatric nurse practitioner for a while now. I'm not on any medication right now, but the therapy practice that I am currently with, I have a fantastic psychiatric nurse practitioner. I still talk with her every month. She'll check in and ask me how things are going, if I feel like I need medication. She's totally fine if I feel like I don't need medication. We had that conversation and we'll come to that decision together. Um, I mentioned at the beginning of the episode that I'm struggling a little bit with my emotions. I'm not going to lie, but it feels good knowing that I have her in my corner and she seems like the type of person who would be able to take my feedback about medication, side effects, things like that. She's very, very open and she seems like we're going to have a good relationship should I decide to start medication. But even if I don't, I still would wind up talking to her once a month just to check in. And it's been very pleasant thus far. So definitely expand your reach out to a psychiatric nurse practitioner if you need to. Just another resource for your back pocket. But yeah, it's not easy advocating for yourself, especially if you're someone who is more passive. If you're someone like many of us in the Black community who has been trained up to respect positions of authority and, it kind of starts like at home. My parents were very don't talk back to your elders type people or, don't talk back to people who know better than you. Just accept it, take it, grit it. Sometimes it's hard for us to unlearn those behaviors even in adulthood. But like T-Kea said, that is something that you can talk with your therapist about and they can help you work through that. So you can kind of develop some boundaries around being pushed to do things that you don't want to do and being able to stand up for yourself. So that was an excellent point, T-Kea.
Yeah, and I thought about when Jordan was talking, going back a little bit to like how you said you was the patient that wasn't doing what they were
Ooh,
supposed to be
yes,
doing.
yes, yes.
But the thing is also like even outside of that, like having people in your corner to like, kind of check you a little bit gently. Because like, for instance, Jordan talks about how like you talk, no, I ain't talked to Dr. T girl, and she always sends me this GIF that just irks me. It's the GIF with with the belt, with this black with this black man, and he's got the
He's
belt. He
doing the
like with the belt, and I can't stand it. When I see it, I just want to throw my phone. Like but like having it's like I need the push, and I know it's coming from a good place. It's just like, oh boy, it's like I know I need to contact Dr. T. But then when it's flipped, I'm like, Jordan, you take your medicine, like, and
Mm-mm.
no, I'm talking to your medication for your physical ailments. And
Oh,
you'll be
yeah,
like,
mm-mm.
no, I ain't taking it. So like, sometimes you got to have people in your corner to give you a little push in terms of like Jordan's advocating for me, like, girl, I need you to get back in. I need you to go see Dr. T. And I'm like, sis, when you gonna take that medicine? Because your body hurting.
Right.
So even like advocating like for each other, like people in your support network. Of course, there's a way to do that gently. Don't say to people like, did you take your medicine? Like,
Mhm.
what's wrong with you? You must have missed that pill. Like don't say things like that because that comes across as being judgmental. But you can push people in a supportive and loving and more of a soft tone kind of way. But just even in terms of, not just advocating for ourselves, but advocating for other people in our lives that we love and encouraging them as well when when they're struggling. So I don't know. I don't know if that's a tangent, but I just kind of wanted to bring that up as well.
You know what? I think that was a fantastic point. It actually brings me back to our episode with the esteemed Dr. Rita Walker,
We love you, Dr. Walker.
who we love over here at Black People Die by Suicide too. And she was talking about like the chapter in her book that's about like passive suicidality. Like not being on top of your medication. So if you're someone who has diabetes and your insulin is really high, you're not taking your medication like you're supposed to, ultimately that will lead to some negative health consequences like your blood pressure, myself not really being on top of my medication with my arthritis. These things that end up having wear and tear on your body. So I think, as T-Kea said, it's a good idea to, encourage your loved one to take them because sometimes that can be a sign that something else may be going on mentally. That's just not as apparent as the obvious stuff. So if someone is withdrawing or not taking care of their hygiene or talking about suicide, it could just be one of those really passive things that kind of flies under the radar. So definitely check in on your people gently, of course, um, and make sure that they're okay. I didn't realize that could be a sign that something might be off with someone's emotions, but it just made me think about that episode with Dr. Walker.
Yeah, and when you were talking, it also made me think about like even outside of the medication piece, like, and I'm not gonna be because we don't shit on people. That's what I'm thinking. But like for instance, if we're eating, like if we know we have high blood pressure, but we're eating pork fat like every day, like we gotta be
Mhm.
like, I need that bacon every day. Now, I'm not talking from a vegan perspective because while yes, I am vegan, but I'm more so referring to like how eating too much pork, if you choose to eat meat, that's fine. There's no judgment here for me.
Mhm.
But more so like that type of meat and
Mhm.
it impacting, like if you have high blood pressure or high cholesterol, like that is literally like a recipe for like disaster if you're
Right.
consuming too much of it, you know?
Mhm.
So when Dr. Walker kind of like talked about that, so it's like having a balanced diet in terms of whatever diet you have, whether it's a regular diet, pescatarian, vegetarian, whatever it is for you. Like, because like eating too much of like even processed foods, like there's tons of processed
Mhm.
vegan food. Just because it's vegan don't necessarily mean it's healthy. Like,
Right.
there's
Right.
vegan comfort food. Like,
Mhm.
so it's when you're talking about like that passive, like kind of suicide, it's more so like making sure that, hey, we're eating the things that help us bring, that gives us fuel.
Mhm.
Um, and so, because there are plenty of times where the doctors, like I have spoken to like psychiatrists who will even ask about like, how's your diet? Like, what are you eating?
Mhm.
Because that impacts our mood too. Like what we eat does impact our mood. And like there's a whole thing called gut brain health, which we should probably
Mhm.
bring. It would be helpful if we bring an expert in to talk about that, So I think while that may be slightly off a tangent, but I do think it's important to kind of like bring those things up because they all kind of just go together. And
Right.
I don't think we realize how things are so much like intertwined when it comes to our mental health.
And I think that's a good point. I don't feel like it's a tangent. Honestly, I feel like some of these changes, even outside of therapy, it's still advocating for yourself. So, for example, my blood pressure's been a little bit high for a couple of years now. And Jordan loves her a bag of hot Cheetos, asked T-Kea. Like, I love some hot Cheetos. Is that helping my blood pressure? No. Is that helping my arthritis? No, because a lot of what's in that are things that are inflammatory to the body. Nothing about Cheetos is anti-inflammatory. So I know that's not helping me. Those are actually things that I can do on my own, even outside of therapy, just slight changes in my behavior to make a positive benefit or impact on my mental health. So I don't think that's a tangent at all. I feel like that's still advocating for yourself. Self-care is
Yeah.
advocating for yourself.
Yes, absolutely, absolutely. I hope that, everyone who's listening got something, you're getting something from this conversation. We really want to encourage us to advocate for ourselves within our families, even at work, like that's another conversation. But if you live with a mental health diagnosis, you need to be advocating for yourself at work as
Yep.
well. Like, because of stigma, we sometimes, many times do not advocate for ourselves, and or even when we do advocate, God rest Dr. Bonnie's soul, she advocated for herself and said she needed help. But many times when Black women speak up, people don't believe us. They don't listen to us.
Yep.
And so it is so important that we continue to push the envelope with advocating for ourselves. Because like with me, I will not take on any opportunities or any jobs that will not allow me to show up and be myself. And it's because, and I know that's easier said than done because bills be billing and life be lifing, and we need money to sustain. So I'm not taking away from that and saying it's as easy as it's just easy, because it's not. But I also know how being in a work environment where I can't authentically show up as myself, it is a matter of life and death for me. And it may seem extreme to people, but I have been in environments that was not good for my mental health. And so now, like, even while we're working to build this organization, I have a part-time job, and I answer the crisis line, and like I had to talk to like the clinical supervisor to say like, hey, like I have to take time away. Like I cannot answer these crisis phone calls and my mental health is not great. Like I have to go into an IOP program. I just recently had emergency surgery. I just lost, my grandfather, and I'm grieving. You know, One of my close relatives, was just diagnosed with, cancer. So it was just like I had all these things going on. And saying like my mental health I'm not doing well right now. I cannot show up and be a support to somebody else. And I have said that. Opposed to before in the past, I would be like, yeah, no, like I can't say what's going on. They know I live with the mental health condition. And I was even reaching out to the clinical supervisor to say, like, hey, do you have any referrals for different IOP programs? Like when mental health is not well. And they were super supportive, like, do what you need to do, take time away if you have to do like a leave of absence, even though I was only working there like 10 hours a week. But 10 hours may seem like, oh, that's not that many hours of working per se. But when I look at the scope of all that I'm doing, Jordan will tell you, I work like 60 hours a week. Y'all don't ask me how I do it. But so I had to rearrange some things around in my life. And so that was me advocating for myself in the workplace. Like I was like, I have to do this. And even like when I would interview for jobs in the past, I would ask about like, what are their policies on mental health, or do they have short-term disability for when people need to take a leave of absence for their mental health? This when I was like looking for full-time jobs. And now since I'm like doing contract work, you don't really get those benefits. But I would ask jobs about this because I would need to know. And so I just want to encourage people to even think about that, like outside of the mental health support that we need, but just overall, the advocating for yourself is so important because for some of us, like myself, it is a matter of life or death. And I refuse to suffer in silence. Like I'm not doing that anymore. That thing almost took me out of here. And so I continue to do that. And while yes, it's not always easy, but it makes me proud of myself. And it's also very liberating because now I feel like I can authentically show up as myself in any space that I go into. And that has been one of the most freeing things that I could have done.
That was beautifully said. I think this was a really good discussion about advocacy and the importance of making sure that we're able to speak up in the setting of clinical treatment, and making sure that we get what we need, because ultimately that's what's going to help us with our mental health.
Yeah. Do you have anything else to add before we move over to the next segment?
I think we're good. All right, so for today's spotlight, for those of you who've been hanging with us for a while, you know that our spotlight is our opportunity to highlight the life and the legacy of someone who has passed away from suicide. And today we are going to do Chris Vaughn. His mother actually reached out to us over the summer. He passed away from suicide in 2021. He was struggling with post-traumatic stress disorder for some time before this. And in 2002, his mother, Deneen Vaughn, and his brother, Cameron Vaughn, founded the Mind and Wellness Foundation in Chris's honor. And per the organization's mission statement, the Mind and Wellness Foundation is committed to saving the lives of young people, particularly those of color. Through increased awareness, education, research, and access to resources, we seek to eradicate the stigma and change the narrative around mental health, paving a new path that changes the way mental health is recognized, discussed, supported, and cared for in communities of not only people of color, but all communities. So after Chris's death, his mom and his brother wanted to dedicate this nonprofit organization in his honor, which they've done. And to Chris, we just want to honor your memory. And to his mother and brother, we just want to commend you for taking that opportunity to help others, even in your time of loss and hardship. And for today's resource, we always like to leave you all with a little something, something. Something
Is
to
that
check
you?
out, something to look
You
into.
that's you? You gonna do the
Yeah, I
resource?
can.
Oh, okay.
So we're going to do No More Martyrs. It is a mental health awareness campaign committed to building a community of support for Black women with mental health concerns. Through Sisterhood, No More Martyrs encourages a culture of self-advocacy and self-care that dispels mental health stigma, raises awareness of mental health concerns, and increases utilization of mental health services. You can follow No More Martyrs on IG at no_more martyrs and check out their website at nomoremartyrs.org. And I'll also be sure to put the Mind and Wellness Foundation dedicated for Chris Vaughn in the description box.
Oh, gonna double back a little bit. So No More Martyrs. So yes, they are a campaign, but actually, so they rebranded, and I don't know if I can tell you, but they rebranded and now they are the Black Women's Mental Health Institute. Because a lot of people,
Ah.
didn't really know what martyrs were. Like you would always constantly have to like explain what it is. So they still do have the campaign, and while they still do use the names for other initiatives, the yeah, they still have the campaign, they still use it for other initiatives, but the name of the nonprofit organization is now the Black Women's Mental Health Institute. And shout out to them because they are the sponsor. They're sponsoring our peer support groups for the rest of the year. So that's how we're able to offer the support groups free to you. So shout out to everything that they're doing. Dr. Nadia Richardson is super dope. She is so funny because like we are one and the same. We'll talk on the phone and she and I'll be on the phone for like an hour and a half. Like she's doing like 50,000 things at one time. Like she's has her consulting business, she has her nonprofit, and she's just doing all this stuff. And I'm like, girl, I'm talking to you. She's talking to me, and I'm like, I'm talking to myself. So, but she's doing some amazing work down in Alabama, and we're very grateful for the work that she's doing with the campaign as it relates to No More Martyrs, but then also the rebrand of the organization as well. So shout out to Dr. Nadia Richardson and the Black Women's Mental Health Institute. I guess that's me. I'm going on, right? The next
Want to do
segment.
Community Changemaker? Yeah.
Yes, I can do it. I have my little iPad over here, y'all, with my notes. So I'm just trying to make sure. So I had mentioned earlier, and it's like, Lord, Jordan, my stomach, as soon as I'm like, oh God, I had mentioned earlier about how, I was dealing with some emotions because of the recent passing of Hydeia Broadbent. And I met or started having conversations with Hydeia when I was in college at an undergrad at Howard. When I was in college, I started this organization on campus called Lady Me. And basically it was like, teach me how to be a lady type of thing. I don't know. But we created this it was called Lady Me Mentoring. Created this mentoring program where we connected high school students to college students and served them and provided them with mentors. So this was the first, okay. So I have always been entrepreneurial. So I'm taking it back a little bit to my college days. But so we had put this mentoring program together, and we put together workshops on sex education and goal setting. And I got the movie theater donate tickets, and I was getting donations. Like, I literally formed an entire mentoring program on Howard's campus, and I had a whole committee. I had staff that I was running. Like, it was, yeah. So I got a lot of those entrepreneurial skills from back then. But so I reached out to Hydeia when when I had this mentoring program, and I was like, wanted her to come speak because um one of my friends on campus was like, you should get her to come speak. I think she would be really good. So, but it didn't really work out. We weren't able to do it because the organization, we didn't have enough money, excuse me, to pay for her to fly from Las Vegas to DC. So it was like, okay, but she and I still stayed in touch after that. And we became, we befriended each other on Facebook. And we used to always talk on Facebook all of the time. And, as I was thinking, when I saw on social media that she passed away, I was like, so much was going through my mind at the time. If you don't know who Hydeia Broadbent is, but she's like a prominent HIV and AIDS activist, or was. She originally was on the Oprah Winfrey show, and she was talking about her experience when she was just like 6 years old, talking about, what it was like to live with HIV. She was actually born or considered to be a part of America's first generation of children born with HIV. So she was born with it. She was adopted because she was left abandoned at the hospital. And she has been literally advocating since she was like 5 or 6 years old, and sharing her story and going out and speaking and being a part of the BET, like their campaigns that they used to do for like raising awareness and encouraging people to have like safe sex. And excuse me, she was even on like Nickelodeon, and there was a clip that was circulating about with like her like breaking down and crying as a child and just saying like she wants to be treated normal. And Hydeia was, she was only 39, and she wasn't supposed to live to make it past 5. And um while her story is not suicide related per se, it still has a mental health component because Hydeia did struggle with depression. I don't know if she's ever struggled with suicidal thoughts, so I can't say that. But in her blog post on her website, for her 34th birthday, she wrote, these last few years have been extremely difficult, struggles with depression, which reached scary points. Depression so dark, I was not sure how I would see the beauty in life again. I was unsure of how I'll pull myself back up. I now have a new outlook. I'm able to I'm able to now see the blessings and lessons from my valley. I'm a warrior. I rise each day with purpose while still being a work in progress. And my stomach is just doing all sorts of things right now because I think about how Hydeia, was only 39. But her life was so rich, like full of ups and downs, like everyone's lives, but to be able, it was short as in a number of years, but rich and long in the sense of impact. And I'm like so emotional over it because it makes me think about like that's why I am the way that I am when it comes to like going after my dreams, because we don't get to have get to the end of our lives or and be like, oh, I want to redo. I have been having a very hard time just with grief, death, what my death might look like, losing other people, how it might impact. Like it's just I have so much work to do around it. But Hydeia, just want to thank you for the amazing work that you have done and knowing that it's not in vain. I know that she will be greatly missed. She has made waves in advocating for those with AIDS and HIV. And I, haven't talked to her, it's been a few years, but man, like I didn't know that it would bother me in the way that it did. Someone that I had went to school had posted about it, and that's how I found out. And I just broke down and I started crying because I was like, oh my gosh, like for it was just so much that was going through my mind, thinking like, wow, this is sad because she died. But then also within her short 39 years of life, how much she's accomplished. And I just hope that with this particular community change maker, that anyone who is listening, if you have a dream, if you have something that you want to do, I know it's easier said than done, but please do it because, life is so short and we don't know when our time will be. Is death is inevitable. It's the circle of life. Like it happens. Um, but it just put things into perspective for me and kind of got me thinking like, wow, I want to like I want to be like Hydeia in the sense of like despite her life's challenges, she still made an impact. She didn't just like, oh, I'm not gonna, not gonna do anything. I'm not going to live a fulfilling life. Like her life was still very rich, even with her everyday challenges. So I thought it was appropriate to dedicate this community change maker to Hydeia Broadbent. And so may she rest in peace. Your girl, I'm fighting back so many tears. So I'm like, okay, I just want to get through this. But yeah, so yeah, that's why I'm gonna, let you go. And oh, I guess it's gonna take us into our next segment, which will lighten up the mood a bit, because Lord, I need it.
Oh my God.
Yes, this is a new segment. We're bringing y'all something new for this year. People say the darndest things when it comes to suicide. Like, if you are someone who has struggled with suicidal ideation and you have told other people about it, we are sure you have heard some things that were Michael Jackson off the wall. And here's one of them. You're too pretty to be depressed. Uh, what does that have to do with anything?
Right. Who
Like,
said I was ugly? What?
okay, number one, who said I was ugly? Number two, what does that have to do with my mental health?
Right.
Pretty people don't die of suicide. Is that the thought? Like,
I think when so this was said to me, I think when it was said by a nurse, and that's when I knew these doctors,
oh
this was
no.
like in my heyday when I first was like my very early stages in terms of like just being diagnosed, and I was looking for a new psychiatrist, and one of my mentors was like, I made you an appointment with this primary care doctor just so you can get your meds because I know that you're struggling. And the nurse is like, you're too pretty to be depressed. And it's like, one, I never said I was ugly. I've never thought I was ugly a day in my life. Two, I think what she meant, I guess she made the assumption that people who struggle with depression have low self-esteem. That's the only way I could rationalize it in my head. But it's like I was not suffering from low self-esteem. That was not my struggle. You just out here making assumptions, thinking because I want to die, I have low self-esteem. That was the furthest thing from the truth. So I know that as it relates to suicide or as it relates to anything mental health related, people have said the darndest things to us. And so we're not sure we're going to do it every single episode, but we do want to, pop it in there every now and then because I don't know if we're always going to have the darndest things to say, but I do have a nice library. If you are listening and somebody has said some off the wall stuff to you, y'all email it to info@blackpeoplediebysuicide2.org because we won't say your name, but we will definitely read it on the podcast and talk about it. So yes. Jordan, I don't know if you ever had anything said to you that might have been oh my God.
Oh, I've had plenty. Plenty. We have lots of material for this. Lots of material for this segment, but we are curious to see what our listeners and viewers also want to add. But I've heard this too, and I was just like, oh, am I just supposed to be like, oh, I'm pretty. I feel better now. I'm not depressed
Right.
anymore. I'm like, people say things. I don't know if they just don't know what to say. And maybe that's the case because suicide is so taboo. But this is why, like, organizations like ours and others who are doing mental health, particularly suicide advocacy work, is so important because we kind of teach you, like, you probably meant well, but that was a little condescending. That really didn't help the situation. But I got lots of material for this segment. Y'all stay tuned.
Okay, well then I guess that's gonna bring us right on into the self-care.
Self-care. All
Jordan, I'm gonna let you
right.
go, girl. I'm gonna let you go.
You know what? My self-care. I am There's one particular medication that I don't have access to. My insurance switched and I've attempted to make contact with my rheumatologist's office, but I haven't like actually I don't know. I haven't actually followed through on making sure that I get that appointment scheduled. So that's number one. That's what I need to do. But number two, I have medication that I can take in the meantime, and I've been taking it like here and there. It's definitely a very slow acting medication compared to the one that I usually take and have no issues with. But I know that if I begin to take it like I'm supposed to, because that is a thing for me, that will help, with my joint pain, probably help with my fatigue. It'll just take a little bit longer, but it will definitely do something in between the time that I get to see my rheumatologist again. And I know she's gonna fuss at me, so I'm a little bit I love my rheumatologist. She's great. She will drag you, and she loves to drag me because she's like, "Where have you been?" And you know what? That's okay. That's okay. I'm gonna go in there and get my hand smacked, as I so rightfully probably deserve, and we're gonna get back on track. That's gonna be my self-care.
So that means you're making this appointment within the next.
Hopefully, they're open. The only day they're closed is Wednesday. Um, so I have a few more
They're open on
days.
Sundays?
Oh, no, no, no. I'm sorry. Let me back up. So throughout the week, they're not open on Saturdays and Sundays,
Okay.
but throughout
Okay.
the week. So I have a couple more days this week that I can make sure that I call I'm gonna get my hands smacked, but it's okay. It's okay. It's gonna get me on the right track. I'm always so exhausted with like my rheumatology appointments because there's lots of other things that I have to schedule to go with it. So I have to get an eye exam for one of my medications. My iron is usually pretty low, so I have to go to hematology. It just feels so daunting to me, and I usually get into the groove and I'll have all my appointments set up and I'll follow through with the plan for a little while, then something just throws me off track. For this time it was a change of insurance and I just haven't followed up, but I know that that's going to help me with my physical health, which will then in turn help me with my mental health, I believe. And even still, another thing that I'll do for self-care is I'll just monitor, I guess, my mood and how I'm feeling. And I have an appointment with my psychiatric nurse practitioner next month. And I'll be sure to check in with her and let her know how things are going. And, if we have to talk about medication, I'm not mad at it. I'm open to that. I've been on medication, off medication. Again, not taking anything now, but I'm open to it if that's what I need to do to help me feel better. So that's gonna be my self-care. It's a very heavy self-care. Again, my rheumatologist is going to drag me, but that's okay. It's okay. T-Kea, what you
Well,
got?
good. I'm happy for you that you're see when you're talking, I just hear self-aware. That's what I hear. Self-awareness. That is the benefit or one of the many benefits of therapy because when there's so many things that come to light, but I am happy for my friend that she is going to get her stuff in order. For self-care, Jordan, I'm laughing because so there are two things that I want to do like in the immediately, like right once we're done recording. And I feel like it would be helpful to go to sleep because I think I just had a very long day. Like I have literally been on my laptop since like 5 a.m. I'm not joking. I got dressed to go to the gym because that's typically what I do at 5 a.m. But I just was feeling slightly anxious because my anxiety has been a little high. And I was just like, oh my gosh, like I have all these things to do. Like work wise, but I know it is actually counterproductive to just work, and not take time for myself. So I am very much so aware of that. I am an overachiever. I think we've established that. And so I'm just thinking because I didn't get my workout in and because I still currently have workout clothes on, I'm like, T-Kea, maybe you can do like just 30 minutes. You don't have to do a full hour. But then it's like, but girl, you're tired and it is literally the evening. So it's like you could just go to bed and you can just go tomorrow morning and just get some rest. But because I don't like breaking my schedule and I struggle with I also struggle with maintaining my weight and all of these things that's just going through my head. It's like, girl, you can have one day, just go to bed. Like just go to bed because when I'm thinking about like how my body is feeling right now and asking myself, T-Kea, what is it that you need? I'm really trying to tap inward. And my mind says go to the gym, right? My body says go to bed. So I am for self-care. I feel like in the right now, I need to go to bed, but I honestly, Jordan, I don't know what I'm about to do. I don't know if I'm about to go do a little quick 30-minute workout and then come back and take a shower, or if I'm just about to just crash after we're done. So I don't know. I'm teetering what I'm trying to do for self-care because whatever I decide, it needs to happen once we're done recording. So that is where I currently stand, okay?
Okay, question. It doesn't sound like it. But are you one of those people who, like, if you exercise at night too close to bed, you can't go to sleep? I think I'm
You
one of
know
those
what?
people. Like, you just feel revved up.
You know what, Jordan? You are probably right, because I have had small moments and I'm just like, yeah, see, this is why I go in the morning. But I had a method to my madness. I was going to, I was like, okay, let me just take something to go to sleep. Just if I go work out, I'm like, I'm gonna go take a shower and I'm gonna take something to go to bed. But I know if I take it too late, I might be in trouble, because then I'll be groggy and I have a hard time kind of getting up, because waking up at 4 o'clock, y'all, is not for the faint. Okay. It is not. Okay. That's partly why I think I'm better than everybody else, because y'all don't get up that early. Okay. I just be walking around like a devil wears Prada, like, oh, you guys don't have nothing on me. But it is very hard to do that, to say the least. So it's like I have to go to bed at a decent hour, because if not, I just won't get up. So for self-care, yeah. But yeah, to answer your question, sorry, I went off on a tangent. Yeah, I think that might be the case, just because now I don't know if that was my normal routine, if my body would be okay, but because my natural routine is to work out in the morning, it may throw my body for a loop, like, hold up, girl, what you doing? This is not what we do.
This ain't morning time.
So that is where I currently am, but I do, and it doesn't have to be anything hardcore. I honestly, I have a very hard time not treating myself like a robot, because like I'm very like regimented, and like when I get off my routine and my schedule, I don't like that. Like my mornings are pretty strict, my evenings are pretty I would say if I had to give my overall routine a grade, it would be like a B, a B. I would say like a B. A B is like really good, because I'm not perfect, but even like going to bed at night, like I go and I get my diffuser and I put my eucalyptus in my lap, eucalyptus and peppermint essential oils, and I go and I have my bath and brush my teeth and kind of do all those things. I'll read a book for 20 minutes, and then after I read my book, I'll put my ambient sounds on, like the water or all of that. I put my eye mask on, y'all. 15, 20 minutes, your girl is gone. So like those routines are important. Like, and then I'm getting up in the morning, then it's like I'm going to the gym. And then when I'm done at the gym, I may journal, or I may do some deep breathing, I may do guided meditation, I may listen to a TED Talk or a podcast. Then I kind of start my day. But I say all that to say, like, those are my self-care routines that I realize they help to sustain me, because it's like I have to do those small things every day, because if not, T-Kea will work from sun up to sundown. Today's a perfect example of that. It was literally the sun came up. I was up at 5 and I watched the sun come up, and now the sun has gone down. And where am I? On my laptop. So I'm saying all of this to say your girl is struggling a little bit, but that's why it's so important. I think that we treat self-care as a proactive thing versus reactive, and use self-care as a preventative measure, because if I do today what I did today, if I do that for an extended time, we're gonna be in trouble. We
Right.
will be in trouble. So this is just a honest uh conversation in terms of like where I currently am. So I don't know if I answered your question, but this is just where T-Kea currently is.
You answered it perfectly, and that is an excellent segue into the moment of inspiration, actually.
Yes, that I found, right? So I guess I should read it so I can say it. I could get it
Go
in my
ahead.
soul and in my
Yes.
spirit,
Yes.
So, okay. This quote I saw, it was on, I think it was on Instagram. It was said by Kaya Nova, and that thing smacked me so hard in my face. She said, "We are no longer glamorizing, we're no longer glamorizing being overly busy. We're focusing on delegating, outsourcing, saying no, and organizing our current tasks. But we're not, she said, we are not chasing exhaustion this year. That's what our sis said. And when I read that, I'm like, ooh, come on and read me like a book. You know, because your girl be out here struggling. Jordan laughing because she know, like, y'all, it's so deep rooted for me. Like, as it relate, it's part of it is I know what it's like to struggle. I know what it's like not to have. So some of it is a trauma response. It's like I gotta work because I gotta work so I can eat. You know, like. But then the other part is it comes from being ambitious, like what we're working on, what we're building. I love what I do. So I could literally just work all the time. You know, I'm teaching mental health first aid. I'm speaking, you know, at conferences. We're doing this podcast. We're building this organization. I'm just doing so much and I love it. So the other part is that motivation piece, that being goal oriented. I don't know how I do all these things, but it's just reading that just kind of made me think like, okay, T-Kea, what areas of improvement do you need? You know? And I will say I am getting better about outsourcing because we had to do our websites. Well, I had to do my consultant business website over, and we had to do Black People Die by Suicide 2 website over. And I did both of those previous websites. And I was like, I can't do like I can't make, and I don't want to say I don't have the time because I think we make time for what we want, but I would just say I could not have made it a priority because of all the other things that I had going on. It just wasn't going to happen. So we did outsourced, hired a graphic designer to design the website. Now, granted, I had to come up with a lot of the content and, you know, give direction, but ultimately I didn't have to do the physical labor, which would have taken a lot of time, plus getting the content and the assets and all that stuff. So I have been getting better. I've also been referring opportunities to somebody else because a lot of times people will often come to me like, can you do this X, Y, and Z? And depending on what it is, I'll be like, oh, I have another person in mind who might be a good fit because I can't do it. Or like most recently when somebody came and I was like, I really can't do it. So I'll be like, Jordan, are you available to take this meeting? Are you available to, you know, do this? And sometimes she may say no, then we may have to go to somebody else or something like that. But I have been, while I'm not perfect, I do realize that I'm starting to outsource things. I'm starting to delegate things. I'm starting to say like I can't do it, not because I don't want to, but because I don't want to burn out. But I do sometimes struggle with like, you know, putting too much on my to-do list per day. Like I'm gonna have to show y'all another time. I got my whole little agenda thing, and it probably would be helpful if I only put like 3 to 5 things. Your girl be having like 10 things. But then sometimes I'll like go back and I'll write down something that I already did just so I could cross it off and get that hit of dopamine, because that is very real for me. But so I'm just, that moment of inspiration, I don't know if it's actually an inspiration to inspire somebody, but I do think it helps us to be self-aware and to kind of check in with ourselves to making sure that we're not putting too much stuff on our plate. I am in a season right now where there is an overflow of opportunities being presented to me, and it's great. I'm not complaining about it, but I'm learning just because the opportunity is presented to me, that doesn't mean I always have to say yes to it. I have to make sure that it's in alignment. I have to make sure that it's worth my time. I have to make sure, like, because when you're passionate about the work, you want to say yes to everything. And it's just it's just not, I don't want to burn out, then I'm not gonna be able to do any of the things that I love. So as y'all can tell, I am in a current space of trying to cut back, trying to delegate, trying to make sure that I'm taking care of myself. But I just have so many things that I think that I'm juggling. And I am really trying to make sure that I'm taking care of myself and that I don't get too off track my self-care routine. So that is where I am, y'all. I don't know. That feels very somber to end the episode. So it's just like, oh, but I'm not like sad or anything. I'm just more
Right.
so overwhelmed and just dealing with some anxiety for so many reasons. That could be another podcast episode, but yeah, it's just I'm just juggling a lot of balls in the air, y'all. That's essentially what I'm trying to say, because me and Jordan, we have the organization is a lot. It's a lot that we're doing. The podcast, it takes time. We have to prepare before we turn on the mic. We're having meetings with different people who want to partner with us. And then outside of me and Jordan, I'm doing, my consulting business. I'm teaching. Yesterday I taught an 8-hour class, and then that was from I have clients from my consulting business. It's just it can be a lot. So I am currently will be working with my therapist on rearranging some things on my plate and just trying to figure out what that is supposed to look like for me, because we can feel when the plate is full. Like my plate is full. It's not fall, it's the mashed potatoes and stuff is it's not falling off yet, but it is definitely full. And I want to make sure that it doesn't topple over. So that's kind of where I am. So I don't know who this could help. Um T-Kea has been I've used today's episode as a therapy session, if you have not noticed. Okay. I do see Dr. T tomorrow, but talking about it has been very therapeutic for me, because if I wasn't talking to y'all about this, I would be talking to Jordan about it. So like we talked about our podcast, right? We talked about how it takes we took our private conversations and we made them public. It is legit true. I kid you not. What y'all hear on the podcast, this is what me and
That's
Jordan
pretty
talk
much
about
what we
off
talk
of.
about. Yeah, pretty much.
Like, and most of the time it's Jordan listening and I'm just yapping off at the mouth. But it works for our friendship.
You know what? I'm glad you have a space, even on this podcast, to just get it out. There's nothing wrong with that, right? Like, we're gonna hope that you get some good rest because it has been a long day for you. And yeah, you know what? This was another episode of Black People Die by Suicide too. Any questions, comments, concerns, feedback, y'all hit us up. Um, we'll be happy to take your suggestions. But thank you all so much for listening and watching and all that you do to support.
Yes, and we have to encourage y'all. If you have not followed us on social media, follow us on TikTok, Black People Die by Suicide 2. On TikTok, that is the number 2. But you can follow us on Instagram at Black People Die by Suicide 2. That is TOO. Visit our website, www.blackpeoplediebysuicide2.org. Connect with us. We are excited. As Jordan said, thank you so much for supporting us. We will also be announcing, so stay tuned. If you're not on our email news list, go to our website so you can sign up. But next month in March, we'll be hosting a virtual Black and Suicidal, our peer support groups. So we'll be doing a mixture of in-person and virtual, but in March, we will be hosting Yes, in March, we will be hosting our in-person, in March, we will be hosting our virtual support group. So follow us on social media or for our newsletter so you can make sure that when we make announcements that you will be the first to know, especially because as it relates to the support groups, we only limit it to a small number of people. So yeah, but yeah, thank you all so much for tuning in and listening and being a support to us. So we will catch y'all on the next episode.